mula sa Asian Community Development Council. Ito ang Fil-Am in Focus. Mondays at 12 noon, right here on PHLV Radio.
Magandang hapon po sa inyong lahat. Welcome to Fil-Am in Focus, a program brought to you by the Asian Community Development Council, where we dive into critical issues, challenges, successes, and opportunities affecting Filipino Americans. I am your host, Edelvise Solano. Today's episode focuses on health insurance, specifically open enrollment and any updates on new insurance carriers in the state-based marketplace, Nevada Health Link. And joining us is Rosa Alejandre, the program manager for Nevada Health Link. And Rosa has been with the Silver State Health Insurance Exchange since 2014 and serves as the Navigator Program Manager. The Navigator Program awards grants statewide and operates year-round, providing Nevadans with free, unbiased information about health insurance options through the marketplace. And this service is specifically helpful for consumers without coverage through their employer, Medicaid, or Medicare, and offering guidance from licensed navigators and in-person assisters. And Rosa also works closely with certified application counselors program and is a certified navigator herself and a community health worker. So thank you for joining us today, Rosa. I'm so excited to talk to you.
Thank you, Vice, for having me on the program. I'm excited.
Yes, I've how are you this cold Monday morning?
You know what? For me, I love it. I like the season. I like the weather. So for me, it's great.
Yes, me too. It's like I'm seeing our trees like different colors.
Yes, that's so pretty.
But let's get to it. So Nevada Health Link is our state-based marketplace and also plays a critical role in helping immigrants and other communities, not just the Filipino Americans, secure and maintain health coverage by providing access to health insurance. So Rosa, can you tell us how this program supports communities and those who may not have health coverage through their job or Medicare or Medicaid?
Okay. Well, I'll first start off with what is Nevada Health Link and how it supports the communities. Nevada Health Link is a program here that will allow any Nevadan that qualifies, that does not have insurance through Medicare, that you have to that you get for free, employer coverage or Medicaid. If you don't have any of those type of insurances, that is what Nevada Health Link is here for, so that you can get yourself covered either with health insurance, dental insurance, and even an option of vision insurance. We are a state-based marketplace. Our portal, Nevada Health Link, it's actually the online portal, but our actual name is Silver State Health Insurance Exchange. That is what the actual marketplace is. And so we operate the Nevada Health Link portal. And that's where consumers can come in, they can shop and compare plans that we have available for purchase. We have 8 carriers throughout the state, and some are only specific to Las Vegas area, some are specific to the Washoe Reno area, some are statewide. We have over 160 plans, so it's a great place to come and look and see what options are available. And I gotta say, Vice, a lot of our options are very affordable. It's just sometimes people don't know how affordable it is. And also Nevada Health Link is the only place where you can get financial subsidies that will help you with your monthly premium.
Oh, that's great. And just to clarify, State Health Insurance Marketplace is the Silver State Health Insurance Exchange. And the portal is the Nevada Health Link, wherein our consumers, those who are watching, will be able to see plan options from different health insurance carrier, like you mentioned earlier, from vision, medical, and dental.
Correct.
Yeah.
Correct.
And then, like any other immigrant population, the Filipino community faces unique challenges and barriers. So one of the primary barriers is understanding medical terms, health insurance terms rather, because it's very complex.
Yes.
And even navigating the portal, Nevada Health Link, is also very confusing. So Rosa, what are the other challenges you have noticed with the immigrant community, not just the Filipinos, in accessing health insurance, and how, again, is Nevada Health Link addressing them?
One of the biggest barriers or obstacles I can say that we have seen for any of our minorities is the language, right? Nevada HealthLink does a very good job in providing assistance in any language. Actually, we have our call center that if you call our call center and there's a language, they can get you over to language line, which will assist you with over 150 languages. So as far as the languages are spoken, you don't really have an issue with that. Just give us a call at our call center, which is 1-800-547-2927. That is a Nevada HealthLink call center. We also have assisters and brokers that many of them are bilingual or even multilingual with different languages. They also have access to a language line. Let's just say, for example, I know that with your agency at ACDC, you have people that also speak Tagalog, right, for Filipinos, but you also have people that speak Vietnamese or Mandarin and what have you, and that's really great. That's why we like to partner with community-based partnerships that have that type of diverse community network already, and the employees that they're able to help firsthand with any consumers that are facing a challenge with the language. We do have everything in English and Spanish for sure, but we also have some of our information in other languages. For example, we have them in Vietnamese, Thai, Korean, and Mandarin. So we do those 4 main languages. And so again, that is the biggest challenge that we see, but we are trying our best to make sure we combat that and provide as many resources available to prevent it being a barrier for someone enrolling.
That's excellent, because it's very important to provide that support to the consumers, especially understanding the intricacies of the health plans and having those navigators or assisters that understand the culture and the language will definitely help a lot. So 150 languages in the language line, wow, that's excellent. So they just need to call the number 1-800
547-2927.
Yeah, or connect to agencies such as the Asian Community Development Council for if you are in need of any sister licensed navigator to help you find health coverage. Again, and financial concern also plays a role. So, which is, you spoke earlier, subsidies. Our consumers will be able to get a health insurance at a lower cost. Can you tell us more about it?
Sure. So basically how it works is that any consumer that comes to our website, right, we will ask you some questions. The main thing is we're going to find out what your income is for the household and how many people you put as dependents on your taxes. Because our application is a very unique process, and it really goes based on your income and how many people are in your household. So and also where you live. Depending on that will depend on what your premium is going to be. You can choose whichever plan you want. You'll be able to see all the premiums available. And once you put in that information that's specific to you, the system will tell you, oh, it looks like you may qualify for this tax subsidy. Oh, it looks like you may qualify for this other subsidy, because there's actually 2. There's one that's called a PTC, Advanced Premium Tax Credit, that also helps you to lower your monthly premium. And if you qualify for that one, and depending on what your financial level is, you may actually qualify for a second one, which is called a cost share reduction subsidy. And so on that one, usually for the general population, I'm going to say it's the silver plan. If you pick a silver plan and you get APTC, and depending on your finances, you may qualify for a second subsidy, and it'll tell you right then and there. There's no hidden formula. The system will tell you directly. We have what's called a window shopping tool. If you answer about 6 questions, it'll tell you right there. Even before visiting anybody, calling anybody, it'll tell you right there on the system. If you're not sure, give one of our navigators or brokers a call, and they will be able to tell you the same information. So it's not with, oh, if I go here, this person's going to tell me that, or if I go there, that other person. No, all our numbers are the same as long as you put in that same information. Now, the good thing is that with the subsidies, it will help you either throughout the year. You can decide if you want to take advantage of that subsidy should you qualify for one throughout the year, or if you want to wait till once you claim your taxes. It will really depend on that.
Yeah, and not everybody knows about those subsidies and the cost sharing and the APTC. So that's really important for our kababayans to really reach out or reach out to the licensed navigators through Nevada Health Link and the other agencies connected to Nevada Health Link, and by visiting the website. So, and take advantage of the window shopping tool by entering your information, household size, and your income, and therefore you'll be able to know what you qualify for. So that's again, Nevada Health Link addresses these issues by offering unbiased and free assistance.
Definitely. All our assistance is for free. If you ever come across someone that's charging you for assistance, I suggest you, make sure and you use your cautious flags and you say, you know what, let me call this the number and make sure that this is the correct person, because we offer everything for free. The main thing is that with Nevada Health Link, we just want to make sure you know where to go, which is nevadahealthlink.com, for a resource and where you can get the information. And it is for free. Absolutely.
Okay, again, it's for free, so make sure you visit nevadahealthlink.com website to visit any, connect to any agencies and assisters who can help you, especially with the language also. And Rosa, how does health insurance impact the overall well-being of an individual and also financial security, especially for the Filipino-American households?
I have several stories of my own. Insurance is very personal to me, not only because of how it's helped me personally, but also with my mom. I guess I should say no one really knows when you're gonna need it, right? And an accident can happen at any time. An emergency can happen at any time. And if you find yourself without health insurance, in this country, it is a very difficult barrier, not only in accessing the coverage, but accessing the service and also the financial burden. We see that many people, when they go to the hospital and don't have insurance, they end up filing bankruptcy. Because I can tell you, just for me personally, a visit to the ER has been over $32,000. Just one visit. And I don't carry $30,000 in my pocket for an emergency. Thankfully, I have health insurance, so that is what helps me. And that's why it's important to know, hey, this is my maximum out of pocket deductible, or this is the maximum limit I know I will have to pay. Our plans are a little bit over $9,200 a year. That's the maximum. But my visit, if I would have had to pay that bill, I know I wouldn't have to pay more than $9,200. $9,200 opposed to $30,000. Well, let me take the $9,200. And it doesn't mean that I have to pay it all at once. I can also work with the facility, the hospital that I went to, and make some payments. But I now know that if something else happens to me also throughout the year, I'm 100% covered. As long as it's an essential health benefit, something medically necessary for me, I'm completely covered. And those are the things that we forget that keeps us healthy. In the Hispanic community, we have this tendency, and I see it also in other migrant or minority communities. We tend to wait to go to the doctor until it's like, okay, I'm dying here. I can't do this anymore. We wait till the last minute. We don't take care of ourselves a lot in preventative. And if we did that, perhaps it would help us in the long run, not only medically, but financially. And so that's why it's really important to have health insurance, because again, you just never know when you're going to need it. I'm going to just share with you one thing. My daughter was 12 years old. She was having pain in her stomach. She didn't know what was going on. We had just gone to the doctor. He gave her some antibiotics for a throat infection. We thought, well, maybe she's having a reaction to that. It took us about 3 weeks back and forth. The pain would subside. She'd feel better. Then again, it came back and forth. We ended up having to go to the urgent care, and the urgent care says, oh, we can't do anything for you here. We don't have x-ray machines. They took us to the hospital. We went to the hospital. We ended up finding out she has pancreatitis. 12-year-old. It came from gallbladder stones. Gallbladder stones were getting so bad, they ended up having to do an emergency gallbladder surgery. A kid for 12 years old. Who would think? That's something that even the doctor says, this isn't normal. Again, you just never know when you're going to need it. Thankfully, we had health insurance. It was a little bit of a long process, a long road for recovery too for her. But she's good. She's good. She has to watch what she eats and some things, right? But now she knows how important health insurance is for her, right? Too bad it happened at 12. But again, that's why it's personal to me. That's why when I see people, I see our community members, regardless of your race, regardless of where you come from, in the U.S., having coverage is one of the most beneficial things you can do for yourself. I know it can be expensive, but at the end of the day, our health is worth more than anything. Because if we don't have our health, how are we going to help our family? Right? That's what I just mean.
Oh, thank you, Rosa. I mean, I
You're welcome,
completely
Bunnies.
agree because you never know. You said that regardless of your age, your ethnicity, you never know when something will happen to you.
Exactly.
Yeah, and especially if you're living paycheck to paycheck.
Yes.
Then that having catastrophic medical costs will be will be a huge burden to
Yes.
you and your family, and having health coverage will not only ease you when in terms of paying the health coverage, but also preventive care.
Yes.
Making sure you manage whatever chronic condition you may or may not have, and then get early intervention.
Exactly.
So that's very important. And I know some of young ones may know, oh, I'm still young, I'm okay, but it's important, and it will help you with not having financial hardship should you have something happen to you.
That is very true. That is very true.
So in the end, it's having that peace of mind. We already talk
Yes.
about that,
Peace
Nevada,
of
having
mind.
peace of mind,
Yes.
having that peace of mind. So you feel secure not only for your family, but also for yourself.
That is one of our taglines. It's the peace of mind. Yes.
Well, thank you again, Rosa, for that very important, sharing that story, very personal story. And each year, we also, you mentioned earlier that there are health insurance carriers, new health insurance carriers with Nevada HealthLink. And what are these new health insurance carriers and their plan options?
So we have 8 on Nevada HealthLink on the exchange. Some of them only provide services like in some areas, like for example, Clark and Nye County. Some of them only provide coverage throughout the whole state. Some will only be Clark and Nye. But we have 8 carriers. We have Anthem. We have Ambetter from Silver Summit. We have HPN. We have Molina. We have Imperial Hometown Health, Aetna, Select Health. So we have several insurance carriers on our marketplace, and all of them provide the essential health benefits. It's an all comprehensive health plan for sure.
Okay, so they have different pricing structures.
Different pricing structures, and again, it's going to depend on where you live, and it's also going to depend on your household income and your household size. Yes.
Okay. And open enrollment also is incredibly important
Yes.
time for consumers to sign up and make changes to the current plan.
Yes.
And can you provide the importance of open enrollment, and what are
Sure.
the key dates our viewers should know about?
Yes, well, actually, open enrollment is really important in Nevada because in Nevada, you only have a specific time period to enroll for health insurance. So if you don't have health insurance through your employer, through Medicaid, or if you're having to pay actually for Part A Medicare, you can also give us a chance for that if you don't have it for free. But open enrollment starts from November 1st through January 15th every year. And that is the only time you can come into the exchange and look for plans, compare and shop and actually purchase them if you don't have health insurance already. And again, it's only during that time that you can do that. If you do not apply during that time and get coverage during that time, the only other time you can do it is during special enrollment period, which means you lost your health insurance and that's a qualifying life event. At that time, you can apply for health insurance throughout the year. Doesn't matter when. You have 60 days from when you lose from the qualifying life event to come on to the exchange. But open enrollment is important because that's the only time where the general public can just come in, look for plans, shop and compare, or also even renew the one you have right now and make sure there's not a better option for you. But it's November 1st through January 15th.
of next year.
Of next year, yes.
All right. Okay. And Rosa, to close today's episode, I'd like to ask, what is the best piece of advice that you can provide to our Filipino American families?
Don't procrastinate. I know Thanksgiving's coming around the corner, Christmas, New Year's, but it will go by so quick. And next thing you know is we're January 15th. Please don't procrastinate. You can come online at nevadahealthlink.com or call our call center 1-800-547-2927 and we can help you Monday through Friday 9 to 6, on Saturdays 9 to 2. We are closed on the holidays, so this Thursday and Friday they will be closed, but you can see us at regular business hours as well, and we will be more than happy to assist you with your application.
Yeah, well, thank you, Rosa, for that advice, and also for providing information about Nevada Health Link and all the important dates and information. And like what Rosa said, you never know. So do not wait until something happens to your health. So think about having health coverage and take charge of your health by being proactive, and reach out for our help or any of the agencies under the Nevada Health Link. And our navigators here at ACDC speak Tagalog, so we are here to guide you through the process and make sure you understand your options. Again, everyone, thank you for listening and watching. Visit acdcnv.org for more information. Our, again, state licensed navigators are here to assist you in shopping for health insurance plans, comparing prices, and reviewing your health coverage options, and potentially qualifying for financial assistance or subsidies, APTC, and CSR, cost sharing reduction that Rosa just mentioned earlier. And additionally, visit at nevadahealthlink.com to learn more about the health insurance options available through Nevada Health Link. And Rosa, again, thank you so much for joining us today. We'll have you in another episode to talk about special enrollment period and also some updates regarding DACA.
Thank you.
Thank you, Rosa. And again, thank you mga kababayan for watching Fil-Am in Focus, a program brought to you by the Asian Community Development Council. For more information about ACDC, please visit our website at acdcnv.org and be sure to follow us on our social media channels. Abangan po ang aming susunod na episode. Hanggat sa muli, maraming salamat.